Hi, it's Diane at Allied again, and I want to talk to you a little bit about injections. Mainly, we're going to talk most about subcutaneous injections, but just talking about injections in general, let's talk about a few things. So one is the different parts. You have your syringe. Now here's a few different syringes in different sizes. The syringe is this part, okay? This is a syringe. The needle goes on the end of the syringe. Here's 3 different syringes that I have handy. This is a 10 milliliter, this is a 5, and this is a 3. They come in so many different sizes, and the volume will be marked here. So a 3 milliliter would be this much, 1 milliliter, that much, okay? So you bring it down to this area and you would hold it up and look. So you have the syringe, then you have the needles, plethora of different kinds of needles. Now there's the needle gauge. The needle gauge here we're referring to the bore of the needle, how big that needle is. So let's look at a few here. This is a 22 gauge, and this 22 gauge 1-inch needle is sitting on a 10 milliliter. Remember, cc's and milliliters are the same thing. So it's on a 10 milliliter syringe, okay, and it's a 22 gauge and it's 1 inch long. This is how you know. Now you'll also see that it says lure lock here. Lure lock, this is a lure lock. It screws in, the needle screws into the hub here, right here. That's called a lure lock. Okay, this is a 3 milliliter syringe, and it's a 1/2 inch needle, or 5/8 inch needle, okay, and it's a 25 gauge. Now, the higher the number of gauge, the smaller the needle. So which needle would be smaller? The 22 gauge or the 25 gauge? The 25 gauge. The bigger the number, the smaller the needle, the bore, the size of the needle. Then there's the length of the needle, okay? So let's look at a couple of these. Okay, now this is just a needle, okay? This does not have the safety. This is just a needle, but do you see how it has the safety component in it? This does not. This, some places just do not use anymore, but some places will use it for drawing up or adding to the vial. So therefore, it cannot be a dirty needle stick that way, you see. So you have to be careful, though, not to contaminate that tip. So did you see how I peeled it back and peeled it back without touching that tip? And then you would take your syringe and twist it on like that, okay? Then you can pull off the cap. Now, you should never recap like that, because then you can stick yourself. Okay, so this is a 25 gauge needle. That's pretty little, isn't it? That's a very narrow needle. Not only that, but it's fairly short. What's the length? 5/8 maybe? It looks like it. Yes, 5/8. So it's a very small needle. This is good for subcutaneous. Now, if you do need to recap, which I would hope you probably shouldn't, but if you did, the way you would do it, the way they tell us to do it now, is to simply lay the cap down like that, and then you would scoop it like this, okay? Like that. At that point, you could go like this and toss it. But you shouldn't handle it, a raw needle, out like that, okay? All right. let's look at some more needles. This is a 27 gauge. So would that be larger or smaller than the 25 gauge? It would be smaller because the number's larger, right? Remember, it's the opposite of the way you might want to think. All right, all these three safety ones I have here. Here's a 21 gauge, a 22 gauge, and a 25 gauge, okay? All right, which one's the largest? The 21 gauge, yes. Let's take a look at a 21 gauge. Let's put it on here. Okay. Now, when you pull this down, it's going to engage. Watch. Okay. Now, I would take this off. Okay, now can you see how much larger the bore of that needle is, the gauge of that needle, than this needle? I'm not talking about the length, I'm just talking about the width, the bore of it. Yeah, this one's a lot bigger, isn't it? Uh-huh. This is a 22, this is a 25. Right. So if I had a large volume to put into someone and I needed it to go fast, which one would I use? This one. Okay. If I just had a couple tiny drips that I had to get into someone and I just wanted it to go into their fat, this one. Different needles are used for different things, for different uses. Now on this particular one, after I give the injection, what we do is you can just push this off, or you can twist this. You can push this up. Do you see how you just simply push up? You don't have to use two hands. In fact, you shouldn't. You just leave your thumb to roll right up and cover it, and it snaps like that. And then you would dispose of it like that. Okay, the whole thing. Do you see how that hoods it? Totally protects you from anything. Never pull this back down, especially after you've given the injection, because that would be considered a dirty needle stick, and then you would have to take action for sure. Okay. So I hope that gives you some idea. Now these little ones down here, do you see how small they are? There's just they only hold, like this only holds half of a cc, half of a milliliter. These are 1 milliliter ones. These are generally used for things like TB test, insulin, just a small amount put in either subcutaneous or intradermal. So subcutaneous, sub means below, cutaneous means skin. So we're just putting it below the skin and into the fat. In intradermal, you're putting it in the skin, but below the main layer of the skin, just kind of in the dermal area of the skin. So depending on how big your needle or how long your needle is and how much fat your person has, depends on how the angle will be when you administer the injection. So if I have a needle this big and my person, I can palpate their abdomen, let's say, and I can pinch up a nice good inch on them, then I would probably go in about like this angle. Going in like this will go deeper. Does that make sense? If you go straight up and down, you're going to get further into the tissues, further into the structures. More on an angle, the more shallow you're going to be. So you have to take into consideration the anatomy of your patient, the length of your needle, when you're doing any kind of injection, especially subcutaneous. Subcutaneous, the reason you're doing that is you want the drug to go into the fat, not into the bloodstream or the muscle. You're trying to get it into the fat. Okay, so that's why you would want to do it on the abdomen or on the back fleshy part of the arm. Do you know what I mean? Back behind, not the deltoid, not your big muscle up here, but back in the fleshy part of your arm. That's another good place. On the side of the leg, the thigh, that's an okay place as well. So if I was looking at the skin as this, where this is the different layers of skin and then it goes down into the fat, I'm wanting it to go in here, into this yellow fat area. Not below where the muscle structures and so forth are. You don't want to go there. You're just wanting to go into here. So if this is all the fat they have, can you see how this needle might just be good. But I'd probably want to put it like this, wouldn't I? To get just right. But if I went like this, that's too shallow, isn't it? So can you see? Now, if this person had double the amount of fat, like that, say, then you can see how you'd want to go straight up and down, right? So you just have to think about that. The anatomy, the patient that you're administering this to, if it is subcutaneous, you know you want it below the skin, but not into muscle. You're wanting it to go into fat. And remember your good places to do it. Love handles, not right around the umbilicus, the belly button, not there, but you're going to want to do it off on this areas. And then down around the love handles, the outer fatty part of the thigh, or the fleshy back part of the arm. Okay? Makes sense? All right. Now, let's talk a little bit about vials. How do you get the med into your vial? Now, some syringes will come pre-filled. They already have the drug in them, but certainly not all. Certainly not all. In fact, most won't. Most will be in vials. Now, when you have a vial, this would be an example of a single dose vial. They're very small, and generally speaking, they're single dose. Okay, but you have to read how many milliliters, how many milligrams per milliliter, and then how many milliliters you'll need to draw up, because that'll dictate how big of a syringe you need, right? And then some vials are multi-dose. Multi-dose. In this case, now this is furosemide, which of course is Lasix, which is a diuretic. This has 100 milligrams in this whole vial. And there's 10 milligrams for every milliliter. So that tells me 10 milligrams to every milliliter. So if I needed to administer 20 milligrams, I'm going to need to pull up 2 milliliters, right? Because it's a 10-to-1 ratio. And if I have 20, that's double 10, so I need to double the bottom number as well. So I need to pull up 2 milliliters. Now, vials come sealed and sterile. Do you see this cap? That's how they'll come. When you open a new vial, you simply put your fingernail there and pop it off. You do not want to touch this rubber gasket at the top, because you'll be contaminating that, and you don't want to do that. You just want to pop it off. Okay? Now, go with the policy that your place of employment has, because some will tell you to go ahead and, even though it's brand new, to go ahead and wipe off the top with an alcohol wipe. And other places I've read where they say you can't improve on sterile, just pop it open and use it. Other places, their thought is, how do I know you didn't contaminate it when you were taking the cap off? Go ahead and wipe it down with alcohol. Listen, whatever your policy is at where you work, find out what it is and follow that procedure for sure. Okay? Now, if I'm needing to pull up, this is where I told you that sometimes you may use one of these needles that do not have the safety device on, because if this is just going to be used to draw up my fluid, then I don't have to worry about a dirty needle stick. Now I would have to worry about being stuck with something that had a drug in it, so there's that, but not the dirty needle stick. So if I'm needing to pull up, let's say 2 milliliters, then I would pull up 2 milliliters of air first. Now I'm going to put this into my vial, turn the vial up, and then squish the air into the vial. The reason I'm doing this is otherwise I'm going to have a vacuum when I try and pull it out. Now I turn the vial upside down, and if the vial doesn't have much left in it, I'll pull back on my needle so I don't get air back out, and then pull back nice and easy until I get my 2 milliliters pulled up, and I'll keep pulling until I get the 2. Now, if I look and see that I have a big air bubble, I'm going to pull past the 2 a tiny bit, just enough to compensate for that air bubble. Okay? Then I'll pull the rest of this out like this. All right? Flick this side to get all the air bubbles, because see, I've got one right there, and sometimes you have to tease it a little bit to get the rest of it out. Oops. Flick it and then pull it back up until I just see a bubble forming on the top of my needle. Then I'll look again to make sure I have just right 2 milliliters, and I can administer the shot. All right, the injection. Now, sometimes you'll get a vial that has some dry powder in the bottom of it, and it has to be reconstituted before you can administer the injection. At that case, you will read the vial and find out how many milliliters you need to add to it in order for it to have the correct milligrams per milliliter. Then you would need to shake it, wipe off the top in whatever manner your policy says, and then draw it up. When you do that, make sure you let the turbidity, the cloudiness, clear up before you pull it up. Okay? All right. Now at this point, some places will tell you to take off this and put on a new needle. The reason for that is, if you work for a place that wants you to do that, the reason for that is the needle will get dull. Every time you stick it through, pardon me, every time you stick it through a membrane, it's going to dull that needle. Okay, and especially if you have a vial that has to be reconstituted, where you're going to have to pull up some, what you would have to do is put on a clean needle, pull up some sterile water or sterile saline solution, whatever it calls for, and then you would, so that's one stick, and then you'd stick it into your vial that has the powder, and then you'd shake it, and then you'd have to stick it again to pull it up. That's 3 sticks before you even go to the patient. That might be too much. That might have dulled your needle tip. A dull needle hurts. So if it's the policy of your place that you would replace the needle, then certainly you would, at that point, replace it with a safety needle. And remember, never double cap like that. This is Diane. Well, you're going to have to cut some of that out, Mason. Sorry, I thought I had it. So you never double cap. You would scoop up and then you would remove it with the cap on, but you scoop it, you don't double cap, okay? At that point, why then you could replace it with a safety needle. All right. So now that we have gone through that, let's go ahead and show what that might look like to give an injection. So let's talk about doing a subcutaneous, sometimes I call them sub-Q injection. Remember what I said, you've got to know how much distance, how much fat you have, so you know what kind of an angle you need to go on. So if, again, this up and down, if there's a whole lot of fat and you have a short needle, maybe on a angle like this, 45 or so, and then so you got 90, you got 45, and then if they don't have much fat, then you're going to want to go on an even more sharp angle there, okay? Now, some people will say, do I need to aspirate or not? When we say aspirate, aspirating is when you put that needle in and then you pull back to see if there's any blood in your syringe. The reason you would do that is because you hit a vein. A lot of places will say not necessary for sub-Q. Some places want you to aspirate all the time. It's becoming fewer and fewer places want you to aspirate, okay? But just check with where you work, what their policy is on pulling back or aspirating the syringe before you inject. When you give the injection, let me get this pulled up here. Okay, so when I give the injection, so let's say it would be about like that. In someone who has about this much fat, I would probably go about like this. Now, if it's at some point, some places will want you to pinch up on that to give this injection. Just be careful when you do that. Obviously, know where your needle is going to be. You don't want to stick it into your finger. If you go like this and stick it in, you might get your finger. So just understand your landmarks, okay? Understand your landmarks before you go in. And make sure that you are actually going to be hitting the fat. All right, so when you inject, you're going to put that in and then push. Now, I am left-handed, and everybody has their own little technique on how they hold it and what's going on. It will also make a decision if you're giving this to a child who is wiggly, or you know, if the person has perhaps old skin that is kind of drapey, or well, you know, you're going to have to adjust it to what you might see. Now, having said that, let me talk about your steps. If I'm actually going to do it, you better do that, right? So we're going to sanitize the hands. And remember, how long do you rub your hands when you're sanitizing? Until it's dry. Until it's dry. None of this. No, you rub. You have friction until it is fully dry. Now, when you're doing clean gloving, do you have to wear gloves? Well, it depends on where you work and what the policy is there. I can tell you that I think I prefer it, and I would want someone to wear gloves to give an injection to me. Now, it's a clean technique, it's not sterile, but we still do not want to contaminate any more than we need to. So you're going to have to just pull out whatever you get is what you get that first time. Okay, even if you don't get the fingers on right, let it be. And then for your second hand, you pull out of the container with your gloved hand, not with your dirty hand. And then with your open hand, you try not to touch any of the outside, only the inside. And then with your gloved hand, you touch only the outside. And then we're going to do this, right? Okay. So you're going to want to clean the area that you're going to give an injection to. Before you put on your gloves, you can feel around and, you know, get a good feeling of how much fat is there and what angle you want to take and what size needle you're going to want. And then you're going to come back and clean that area. Remember, in your circles going out. And some places will just say do it once, some places will say do it twice. It's up to you, whatever your policy is. Then you let that air dry, okay? Then you're going to come back, and on this one, I would probably go in about like this, and your bevel should be up. The bevel is where the needle, the opening of the needle is. It's on an angle. It's kind of cut on an angle, and the bevel should be up, and the pointy part should be towards the bottom, okay? So you're going to want to go in, and on this one, I'm not going to aspirate. On this particular one, I'm going to say I'm not going to aspirate. So I'm going to hold that patient's leg or arm or whatever you have. I'm going to go in, and you're going to go in just like that, pretty fast. Push it in, and then come back out. Come straight back out, all right? And then at that point, if they want a Band-Aid or what, you can deal with it then. Then now, do you remember how I showed you to do this? Slide your finger up till it clicks like that. Now there's only about 100 different safety things and different styles and mechanisms. So whatever your place uses. Here's another one that has a different safety one. I don't know if you can see it, but there's a little hub there, and you just push that up when you're done. Okay? Well, I hope that helped you with your subcutaneous injections and learning some of the various parts of how you might do this. Thank you.